Everybody, I'm Gopal Melkote. I'm happy to be joining this.
Good morning, sir. Morning.
It is good evening for me. I'm in California.
Okay, sir. Good morning, yes.
Dr. Melkote has joined us from California.
Okay, that's nice.
He's a great friend of Dubara.
Okay. Very happy. Good morning, Mangala madam.
Thank you, Matin.
Good morning, Kokila.
So we are live on the YouTube. I think we can.
Good morning, everybody. Good morning, Amali, sir.
Good morning.
Good morning, everybody. I am Dr. Satish. I see a lot of, in the audience who were not initially part of, Saturday Club morning meeting. It's because of Dr. Anand's popularity. It seems that so many people have joined. So I'll take a minute to introduce what is Saturday Club of Baroda. It is more than a 55-year-old club whereby Dr. Satish, he is a urologist now in a geriatric age group, octogenarian. He and his colleagues, Dr. Vaishnav, Pramin, and others had started 55 years back where they used to meet physically in a place every Saturday, and the audience would be heterogeneous, who is interested in knowing, it's a hunger for knowledge sort of audience. So that was continued offline for many years, more than 50 years, and for last 3.5 years, after Corona struck, I've been conducting this online every Saturday, uninterrupted. And we invite speakers from various fields in medicine. And we also talk about non-medical aspects of our life also often. So this is the introduction of our Saturday Club. And here we have Dr. Jagdish Patel. Jagdish, good morning.
Good morning.
Who is one of the founders and a very active member of Saturday Club of Baroda. So I welcome you, all of you, for this meeting, and in future also I will be happy to have you join us in this Saturday morning meeting. Now to start with this meeting, we have Dr. Anand Ambali, a geriatric medicine expert from Vijayapura. He is going to talk about fall and old age. They are not synonymous. A very interesting topic. So far we have not heard much about geriatric medicine, so we'll be knowing more about it from him. To introduce him briefly, he is Professor and Head, Department of Geriatrics, Sri B.M. Patil Medical College, Hospital and Research Center, Vijayapura. His qualifications are MD, PGDGM, MSc in Dementia, FGSI, FICP, FIACM, and FRCPE. He is adjunct faculty for medical education at faculty also in Tapasa Government of India Initiative. He is Vice President, Geriatric Society of India from 21 to 24. He has won a state award from Government of Karnataka in 2016. And he's a Commonwealth Scholar at University of Stirling, Scotland. So this is a brief introduction of Dr. Anand. So Dr. Anand, you have about 45 minutes to talk, and we'll keep 10 minutes for interactions. So over to you.
Sir.
Thank you.
Thank you so much, sir. It's indeed a privilege to be part of such an organization where all the senior doctors from Gujarat are joining. And I had a privilege that I am the part of such an group where the people with a lot of experience and wisdom are with me. So kindly bear if I do some mistakes, because I always believe in the experience and the wisdom of the senior doctors than what I talk about is evidence-based, because that is what matters most in clinical scenario. And I also like to thank you all for having me, and Dr. Nina Madam also. I think I am missing her here. So thank you for having me here. So shall I share my slides, sir?
Yes. I forgot to acknowledge Dr. Nene's suggestion for having Dr. Anand with us. Thank you, Madam, if you're around.
Thank you, Madam, and happy to see you all. So I bring greetings to you from Sri B.M. Patil Medical College Hospital Research Center. We are here since 2007 as a geriatric clinic. We have also dementia clinic and the immunization clinic exclusively for senior citizens. So fall and old age, is it synonymous? So sir has already put it as not synonymous. Yes, fine. So after discussion for next 40 minutes, we will come to know whether it is synonymous or not. I also, my memories take back when I visited the Maharaj Sayaji Rao University of Baroda for a speak as a lecturer in year 2010. And then now this is a second event that I am presenting for the audience of Baroda. So next 40 minutes, we will have a discussion on case scenarios, how the fall impacts the older person's life and the quality of life, what are the various risk factors for causing fall in older people, and how we approach and how the older person even himself can prevent a fall, and what are the preventive measures. So whatever is said and done, all of us should be aware that a fall is associated with multiple causes, multiple risk factors, and we need a team approach to manage a person with falls. So it is a complex phenomenon that occurs in the older persons. One single cause does not produce falls. There are multiple risk factors add to it, and we need a team members to make. Ultimately, our goal at a geriatric medicine is to improve the quality of life of the older person who had injuries following falls. Now, falls are the major cause of morbidity in older population. Every older person fall need not develop injuries. Most of the older persons are very smart. Okay, I just want to know among the audience, how many of you had a fall at least in last 1 year? And raise their hands. So, see, none of them here, gentlemen, had a fall. So that's what I'm telling. Not all older people will fall. Not all older people who fall develop injuries. Only around 10 to 25% of the older people who fall will sustain serious injuries. We call fall in geriatric practice as a geriatric giant because it is a presenting feature of various acute illnesses. Like patient is having myocardial infarction. He will not complain of chest pain or sweating. He may present to you with a fall. I will come to that. Urinary tract infection. Patient may fall because of urinary tract infection and not because any other cause. So fall is a very important aspect in the older person because it adversely affects the functional capacity and also impacts the quality of life. Now the falls, not all falls, but few falls will lead to hospitalization. Then most of the time in 10 to 25% it leads to immobilization, and then it keeps on iatrogenic problems in the older persons. So I again endorse that it is a multifactorial and we need a multidisciplinary team to manage fall related injuries. And most importantly, fall can be prevented. And that is what we will emphasize today in our discussion. So we had one old man who had a fever and cough for 5 days. And he was brought to my clinic. He was conscious, well-oriented. His activity of daily living was good. There was no past history or no comorbidities. And he was having benign prostatic hypertrophy. His son being from an well-to-do, well-educated person. And I saw that he had a catheter. It was at night, 9 o'clock, and he had a catheter lying down. And I asked, what is this? And he said, no, sir, I am putting the condom catheter for him. Every night I insert the condom catheter. In the morning I remove so that he don't have to get up in the night to pee. And I said, that's not a good thing, that you should not do that. Then he said, no, sir, I know everything about this. Then fine. But patient had tachycardia, he was febrile, and we managed him on OPD basis and sent him home. But I told him, don't put on this catheter for the old man. You better go for a diapers. That are the alternative availables. That will be better for that. And he said, nothing doing. But unfortunately, the third day, the door rang the bell, and the old man, without his knowledge that there is something called tube in his body, and he just got up from the bed and rushed to open the door. He fell, he trembled and fell, and he sustained multiple injuries, following which he was admitted in an intensive care unit and he succumbed to it. This was a preventable fall. Okay. There's another case scenario, what we get in our practice every day. The old man falls in the bathroom early morning at around 4:30 or 5. And his daughter-in-law notices that the old man had fallen at around 6:30, the time she wakes up. And immediately she was rushed to orthopedic OPD, and X-ray was taken, and fractured neck of femur was diagnosed. Patient became breathless at 9 a.m. And that is how we are called to see that patient is fractured neck, has become breathlessness. The ECG was showing acute interval myocardial infarction changes. So that has already led to heart failure as well. Now, this patient tells us that it is a cardiac event that has led to fall, that has caused fracture. And because there is a delay in detection of almost 4 hours, he has already developed a complication of the heart attack. So this is how the old person presents to us because of fall. So here, cardiac event has led to the fall. Now, what should be our goal? Whenever we come across a person who had a fall, maybe a family member or as a physician, manage the current issue, maintain highest possible level of mobility as much as possible, and modify the modifiable things in home where he had fall, maybe a clutter or what we'll discuss about that. And our goal is to prevent another fall. That is very, very important aspect in geriatric care. It is the second largest leading cause of unintentional fall in older persons across the world. And older people above 60 years suffer the greatest number of fatal falls compared to the middle-aged and children. So this is a very scary situation across the world among the older population. So I again endorse that being old is not a risk for fall. That is very important. All of us should know. But falling changes as we grow old, they may make us to fall. Change in the gait, especially in females, narrow-based waddling gait, or in males, wide-based short-stepping gait, increased postural stay, diminished strength of muscles, maybe as the age progresses, they develop sarcopenia, and environmental hazards or unexpected trip, because nowadays most children are using laptop, mobile chargers are thrown away in floor everywhere in the home. That can even lead to a fall in the older person. So what is important is all these may occur. Now, when we see a patient who is swaying while walking, we immediately advise him go for use of a cane or a stick that prevents a fall. So a fall has a sensory inputs, postural control, musculoskeletal involvement, and central processing. So to cause a fall, many factors are responsible for a fall. So an unexpected event in which a participant comes to rest on the ground is fall. But if he had a fall because of seizures or a stroke, that is not considered as a fall, right? So let us know what is a difference between a trip and a slip. So this is very common in older persons. So a trip happens when your foot strikes an object, as I was telling you, a clutter in your way, a wrinkled carpet, uncovered cables. Okay, and then slips is very common in the wet or oily surface, occasional spills that we don't see on the very shining floor, and again loose or unanchored rugs. That is so this is how the old person trips and slips, and both lead to fall. Both leads to fall most of the times. Now, older persons are so smart, they don't inform their children if they had a fall and some minor injuries. Okay, because the very next moment the person tells his son that I had a fall, then son says, no, nothing doing, no more walking. You will not go out for the walking. They restrict their activity. So the older persons don't repeat, don't inform their children. Falls are very costly. I'll tell you, falls management is very, very costly. It not only leads to loss of physical function, but also leads to independence. And I have seen many daughter-in-laws and daughters have left their job only to provide care for their grandparents or their in-laws following fall and surgery. And 40% of the hospital admissions are because of falls, and post-discharge, again, within 15 days or 1 month, he falls again in a home, right? So function and quality of life are affected in the older person. There's a loss of confidence. Once the old man falls, he feels that am I going to fall again? Fear of another fall. There's a lot of confidence in him. He stops going for the shopping. He stops going for a morning walk. That is how the falls, one episode of fall impacts on the quality of life of the older people. And a quarter of people will break another bone within 5 years. So that is how this cycle of falls and injuries goes on. Then how it differs. A young person, when they walk and trip or slip, they fall in the front. So most of the time they develop injuries over the wrist. Most of the Colles fracture are common in the fall in middle age, whereas fracture neck femur and fracture spine are common in old age because this is how they fall. So that is the difference between the fall among the youngsters and among the older people. And where they fall, any place, anywhere, wherever they are walking, it may be home, it may be a hospital. Nowadays, during marriage season, every week I see one patient had a history of fall because there is a lot of water slipping on the floor, and most of the time they don't see garden, footpath, bedroom, everywhere they can fall. I'll just show you what are the common bones and how the persons come to us. Older person comes to us. This lady, this patient had already a hip fracture 4 years back, operated, and now again he had a fall and he has developed a fracture on the right hip. And this is a patient who had come with the fracture of the vertebral bodies. So these are the serious thing that happens, and it tells us that patient is having the process of osteoporosis. And this again has severe pain. Fracture vertebral body causes a lot of pain, and that has an impact on the patient's quality of life. So what are the causes? It is a pneumonic phase, inflammation of joints, hypotension, especially orthostatic hypotension, auditory and visual abnormalities. Those who have poor vision are likely to fall. Patients with Parkinsonism, patients who are having foot problems, their cardiac issues, leg length discrepancy, illnesses like myocardial infarction, urinary tract infection can lead to fall. The fall is a presenting feature of heart attack and urinary tract infection. Poor nutrition, weight loss, sarcopenia, and gait disturbance. All these can lead to fall in the older persons. Most of the time, the older persons we come across is because of multiple antihypertensives that they're taking. So when they are prescribed more than 3 antihypertensives, we should always keep a watch on orthostatic hypotension. Otherwise, they are likely to fall. So why we call fall as a geriatric giant? Because myocardial infarction, pneumonia, lung infection, urinary tract infection, acute confusional state, all can present to you with the fall. So fall is basically not the direct reason for musculoskeletal disease. These are the diseases which can lead to fall in the older persons. So what are again the risk factors? Patients are taking more medicines. Hypoglycemia. We get at least one patient every month who had an hypoglycemia and fall in the bathroom. Urinary incontinence. People have a lot of urge to pass urine frequently. Nocturia, polyuria, snoring. People who are habit of snoring in the night, they won't be knowing. Their better half will be knowing who is snoring more. So they are likely to fall in the day hours. More medicines. Constipation is one of the again risk factor for falls in the bathroom. They strain for the stools for the long time, maybe 30 minutes or 40 minutes. And when they get up, they develop syncopal episodes and fall in the bathroom. This was another case where we are called as a home visit. The couple was staying in the home. Husband had a fall in the bathroom. The wife got scared. I don't know what to do. Just we got a call. And when we went home, that was what we saw was a right leg was smaller than the left leg, as we tell, external rotation. And patient was unable to move. And we immediately shifted to the ambulance to the hospital for further management. So always the older person should be asked, did you had a fall in last 1 year? Yes, that is very, very important. That itself is a risk factor for another fall in subsequent years. And if the person had a fall twice in last 6 months, he needs to be evaluated comprehensively. That is where he should be referred to a geriatrician. And always look for the medicines that taking. In my practice, we come across a lot of people where new CNS drugs are added, like especially gabapentin, pregabalin. Very next day, they come with giddiness and fall. So that also has to be taken care even in the older person. So when a new CNS drug is added, we should think that is. And most importantly, the elder abuse. We can't ignore this. Most older persons, they being abused, they are being had repeated falls. You evaluate them, no cause found. But this is a lady who came to us, and she was totally deaf, and she had a fall and injury. And their history was the daughter-in-law said she just fell in the bathroom and we brought her here. And once the daughter-in-law left, the old lady was telling, she pushed me, she pushed me. So that is how it happens in even the home. The older persons are physically abused and they can come to you with multiple issues. So we have to consider social issues as well. So most of the older people, they fall and they forget that they had a fall, or they don't want to report it to the children. So after 15 days, they start having swaying or loss of urine control. Then they have developed a subdural hematoma. So again, that we have to ask whether did you had a fall in the past. So what should be done when the older person falls? We look for whether there is a difficulty in balance or walking. Is there an orthostatic hypotension, record blood pressure both sitting and standing? We do a simple test called get up go test. So what is that? We make the patient get up from the chair. Actually, the chair should have both the handles of that, and he should get up from the chair, walk around for 10 feet, come back and sit on the chair. It should not take more than 12 seconds. If he takes more than 12 seconds, he has a chance of falling in the near future. Also, the dual task. This is a very important concept in identifying the older people are having dual task. When we go for a walk, when you two people are going for a walk, and suddenly another person comes from by side of you and you start talking, you will stop, turn your head, turn your body, and then start talking to him. And again, you start state. This is where is the problem is. That you are not able to handle a dual task. Means you are walking and you are talking with the other colleagues. If that is there, then you are likely to fall. But another test we don't recommend in the very old persons, that you can go for this Rikshasana, the tree pose. And if he can stand with this for 10 minutes, 10 seconds without any balance, then he is less likely that he is going to fall. So then again, we also look for cognition test. If he has got early dementia, early forgetfulness, he is likely to fall in the near future. So these are the tests we do in the older persons. Again, simple thing, try to bend down and reach. Tell the old person to bend down and just pick up the object. If he can do that without losing balance, then his musculoskeletal system and cognition is very good. If he loses balance in doing this, he is likely to fall in near future. So that is what we assess in the older person. So what we do in the functional capacity and assessment of the functional capacity in older person, the older persons who are healthier, who are moving around, who have very excellent habits of going outside, moving, taking shopping and all, doing all those things, they usually fall on the stairs away from the home and during activities like reading and bending and reaching. And this is an injury which is serious. Whereas functionally limited people who are only homebound, they don't go outside, they will only be in the home. So they do fall in their routine activities, and they may sustain minor injuries. So what to do when a person falls? When you come across a person who had a fall, look for whether the old person is alert. Did he had a sweating? May suggest a heart attack or a low sugar level. Did he had a tongue bite? That says seizures. Shortening of the limb. Yes, there is a fracture. If he has a head injury, bleed, stop by pressure and arrange for transfer to the hospital. So always ask, did you had a chest pain? Tell him to move all the limbs. If not able to do, then suspect fracture and look for the pain. So this is a photograph given by in Society of Singapore, Aging Society of Singapore, that if a person had a fall, what he is supposed to do. So he has to just crawl towards a chair or a support which is there in the room, and pressure on the normal foot, which is a non-injured foot, and try to climb over the chair and sit there and make the noise or give a call to your neighbor or to your family persons that they are with them. Now coming to the most important aspect, how to prevent a fall. We just published this article in the aging issues and response by in a journal, Springer. So we will discuss now how to prevent a fall. So far, what we understood is the fall is a complex phenomenon, how it impacts quality of life, and how to assess a person who had fall and how to assist a person who had a fall. Now, coming to safety measures. So what we do in our hospital is we put a cushion bed by the side of the cot for all the older persons admitted, so that in the night hours, even if they fall, they should not sustain injuries. Never use these ruggers if you have got in the home. Just remove them, because any old person is likely to fall because of this. We may strip because of he may trip. Always provide supports near the toilets like this, and use the non-skid floor in the home to prevent a fall. Whenever the person gets up from the commode for sitting long time or straining, he should need a support to hold. So please provide such supports if you have got older persons in the home, and also treat the constipation as well. So you can even put such handles just by the side of wash basins and even in the toilets, so that they find a support. When they feel giddy, they find a support to hold something. And this is very important. Nowadays, most of the floorings are done which are shiny, they, even if a spill of water is there, is not seen. And most of the older people fall on such floors, which we see common in the marriage halls and in the halls. When you use the bed rails, always ensure that it should cover only 1/3 of the cot. It should not be a full bed rail. This should help him to hold and get down. It should support him rather than putting it the full pledge. So that is what the scientific evidence says. Nowadays, we have got a socks which has a unequal of this one with branding. So it will prevent slips in the bathroom. So these are the socks which are very economical and easy available in the market, that can be used by the older person, especially during the winter season, and they can even they don't slip in the toilet. There are hip protectors available for the older people. They can put it in the undergarments by the side and they walk. So even if he falls, there is a very less impact on the bone and less chances that he will develop a fracture. So, but most of the older people are not comfortable with these hip protectors, but some people use, some don't use, depending upon their. Now, other preventive measures are always keep lights on in the bathroom throughout the night. So sometimes we rush to the bathroom, we try to struggle to find the buttons in the sleeping mood. So always keep lights on in the bathroom. That prevents a lot of falls. Rubber mats in the bathroom, that also prevents falls. And older people here, whenever you are meeting your friends, wherever you are, don't stand for the long time. You are likely to fall after some time because of orthostatic hypotension or a syncopal episode. In most of the marriages where I go, when I see the grandparents are standing next to their grandson's marriage, I keep telling them, put a chair and sit. You don't have to stand for 4 hours or 5 hours, otherwise you will fall. So orthostatic hypotension, if the person is having, we have to change the medicines. And second is, we have to train the person. Whenever he gets up from the bed, stand for at least 10 to 15 seconds and then start walking. That will prevent a fall in the older persons. Somehow older persons are very fond of the same slippers that they're using for 5 years or 10 years. They don't want to change. I don't know what attachment they develop for that. These are the, again, loose slippers lead to fall. And bifocal lens. Whenever what is suggested is always have 2 sets of glasses. One is for the distance and 1 year, because this again is a risk factor for the falls in the older persons, especially when you are climbing down. So older people are more at risk when they are climbing down. They can fall more when they climb down than they climb up. So we always recommend that when up, use stairs, when down, go by escalator or the lift. So this prevents falls in older person. And dhoti, which is a traditional wear in this part of Karnataka and Maharashtra, this is also one of the risk factor for fall in the older persons. Never ever try to stand on the stool and do some activities in the home. I request all the older persons here, and if your grandparents are there, please tell them not to do this such on the stools, and always place the items which are easily reachable and take. Never take your pets for in a morning walk. This again leads to falls in the older persons. And always put colors in the staircase. This is what I've done in my home also. Top and bottom, we try to put one color so that we will come to know that this is a start, this is end, there's a landing, again start and end. So always it should be, and the whole of the flooring or steps should be away from clutters. There should no be clutters, and they should have a handrails as well. In most of the countries, people are afraid of older persons being fall in the hospitals, though they're dying on the bed, which should not be practiced. This is a photograph from the Washington Post that the older people are in the hospitals in USA. They are being tied to the bed only to make sure that they should not fall. But that is not the right practice. We should always try to find the cause for the fall and prevent. We get many patients who are having uncontrolled diabetes or newly detected benign prostatic hypertrophy, or they have got habit of drinking more water in the night. So they have to get up frequently for passing urine. So that leads to disturbed sleep, and that is one of the risk factors for fall. So what we recommend them is, till your problem is solved, of passing more urine in the night, keep a wide mouth bucket next to your bed in the night hours. The old bucket you can keep next to bucket. When you get an urge to pee it in the night in the bucket, close it and go back to bed. Pee, go good, and then in the morning you can clean the bucket and keep it back. So this will prevent falls and falls-related injuries in the older persons. And once the problem of BPH is controlled or sugar is controlled, then you can stop this practice. This is just a small video which has been made viral recently, showing an old man. See, this is how he is climbing and doing the things. I just told you not to do these things by the older persons, because this is a little scary. I'll just not show you the complete video, because see, this is how he'll lose balances and he will fall. So that should not happen with the older persons. So we recommend walking with a cane, and the cane should be used on the good side of the body, and you should move along with the body. This is the old man who had come to us with that. He is comfortable with these two canes, and he said that I don't sleep because I work in my field and we don't have tiles like this. I'm comfortable with these two canes, but he is not using in the right way. What is the right way of using a stick or a cane? The height of the cane should be at your wrist level. It should not be too tall or it should not be too short. Okay, in this person we see that they are too short, so he has to bend. So if you keep the height of the stick at the level of your wrist, that is the right way of using the cane. So we had one lady who had an urge to had a risk for fall. Okay, so what happened was I recommended him that get a stick for your mother. So he brought one stick. And after 1 week, when she came for follow-up, she was not using this stick. I told him, get a better one. So maybe your mother is so fashionable that she may not use. So he got another costlier stick. Again, she was refusing to use this stick. After 15 days, she came and I asked, are you using the stick? Where is the stick? We didn't bring the stick. He said, no, I'm not used to that old. Now, I asked, what is that you want? You tell your son. She said politely that, see, I want something new stick. These are available in market. These are foldable sticks. I can keep in my purse. And whenever I feel giddy, I want to use it and I want to keep it back. But that doesn't serve the purpose. Now, what I want to tell you is even the older females are very fond of, fancy sticks. Understand? But she needs to use it regularly. Not that when she feels giddy, right? So in all the older persons, we request to sit down. We tell them to sit down when you are wearing shoes, when you are having bath, when you are wearing clothes following bath, and whenever you are traveling, don't go and stand near the exit doors. You sit there for a long time. This will prevent falls and falls-related injuries in the older person if they just follow these basic things in day-to-day life. So coming to the exercise, yes, walking is the best exercise. yoga has its own benefits, but what is more important is strength and balance exercise are more beneficial in preventing a fall in the older person. Now coming to the digital era, there are many sensors available in the market. This is the one sensor which predicts the fall, which informs the person, your son or your daughter, that the person had fall in the home. The good thing about this sensor is it doesn't have a camera, so you can place it in the bathroom, you can place it in the bedroom, and it will sense that you had a fall. It sends a message to your children wherever they are in the place. Just it needs a 24 hours Wi-Fi, and it just costs $250. And there is another sensor that you have to just wear around the neck. And whenever the old man falls, he has to just press the button. So most of the times, when the person falls, he himself is in so much of problem, and he may not aware that there is something called I have to press. But still, it is good. You can just press, the message goes to the family member that he had a fall. Now coming to role of vitamin D. So vitamin D supplementations will not prevent fall. Only it reduces the chances of injury following fall. So prophylactic supplementation of calcium and vitamin D will not help the older persons for preventing a fall. Okay, so that is the message we have to take. Just a supplementation of vitamin D. In fact, it is found in one of the study that it increases the incidence of fall. So avoid unnecessarily taking of vitamin D and calcium supplementations just to prevent a fall. There is an app available on your phones that is called Nimble app. It will make you active. It will make you exercise. It will make you stretch exercise for every 10 minutes a day. And it will make a recording in your app. And you can see how you are doing, how much you are walking, how much mental exercise, how much sit-ups, stand-ups you are doing, and how many steps you have put. Everything will be shown in this app, and it helps you to tell that whether your activities are doing perfectly or not. And this is one of the stick that is available. I think many of you are aware that this is a stick available in the market now, which is very sturdy, and it has even the very sturdy. It has a light. It is adjustable. It has a light in this. Even if you are working the night, you can watch on the camera on the light in this. And if you have fall, you have an emergency button. You can just press. It makes noise like a siren. If you are sitting alone and if you want to hear some songs, it has even FM. So these sticks are now available in the market. So the older persons can have this, and then they can utilize this stick for multi-purpose stick they can use. Now coming to the senior-friendly facilities, what we have done in our hospital, we have an even landing out of the hospital where the older persons coming on two-wheeler or auto rickshaw, they can just stand at the level of the road, and they climb, they come to this ramp, and we have placed the tubes across the hospital. So the person who wants to walk and they have support to get with the rails across the hospital, they have rails. And we have placed a low bed cot for all the older persons in our geriatric OPD that will help them to sit, and they don't have to climb the table and all those things. We also have an wheelchair that you can make any positions. You can make it flat, you can make it 45 degree, and there is also a commode table for this. And you can even take ECGs making the patient lie on this. So to conclude, not all older people fall, and the best predictor for an increased risk of fall is a past history of fall. If he had already a past fall in the past, he is likely to fall. And in the older people here, I request not to ignore mild symptoms. Please consult a doctor. You just don't blame it on the age. Arey, abhi buddha ho gaya, I am going to have giddiness, I am going to fall. No. So that is not the part. It is not synonymous with old age. Not all older people will fall. And even if they fall, not all will develop serious injuries. And once they develop serious injuries, it has a negative impact on their life. So just to end that, a good patient, the one patient telling that I don't want to inform my doctor that I had a fall, but I lose my independence. But the smart patient says, no, I want to tell to my doctor because he will guide me in so many ways and prevent another fall. So that is the difference between a good and a bad patient. So just to conclude, so it is said that boy falls to standing, young falls to love, and elderly falls to fracture. So thank you very much for your patience hearing. And now the topic is open for question and answers. I
Thank
think
you,
I am
Doc.
on time. So
Thank you,
so
Dr.
much.
Anand. You finished well in time, not only well in time, but it was wonderful journey of knowing about how to prevent fall and what can happen if you fall. So wonderful. And now we are open for any questions, discussion, comments, etc. My first question is Dr. Anand about older people living in a house where there are multiple levels of steps. They build the house when they were young, but now they realize that there are multiple levels of steps. Should they move to other house?
Instead, yes, sir. If they are not able to climb the stairs, at least they can shift to the rooms that are in the ground floor.
Right.
Usually, the rooms in the ground floor are for children, and then so shift the room from a top floor to the ground floor. And if you have got multiple steps, it is always a risk for fall.
So now open to others to ask. Yes, Dr. Jagdish, yes.
See, congratulations that you have a geriatric clinic.
Thank you, sir. Thank you so much.
In city of Baroda, I don't think we have a separate geriatric clinic, which is a need for the society.
Yes, sir.
So another thing, activity of daily living should be given as a training to all old people, and they should be categorized that all the following activities should be taught to all the elderly people. Activity of daily living that will make their life easy and prevent the falls.
Sir, I'll do it, sir. We'll do it.
Yes, Amali, sir. Amali,
Yes,
sir, that was an excellent talk as usual.
Thank you,
sir is
Thank you,
an
madam.
expert. Yes, wonderful. He has great insight, and he always, he explains everything so practically. All those suggestions and tips of yours were great, and we will also remember them when we are teaching or training the patients. And one simple thing, one more thing which we have to tell the patients is not to rush. Most of the times they fall because they rush, as you mentioned, like for opening the door or because they have to go to the bathroom and other activities. So if they don't rush, a fall may be prevented to a large extent. But the lecture was wonderful, sir. Thank you very much. I'm happy I attended.
Yes. Thank you so much, ma'am.
Sure.
Yes.
Can I say something?
Yes, sir. Please, sir. Please.
You see, you are telling us some helps or tips for safe walking and things like that. Now, can you elaborate on how you manage while climbing the stairs or getting down the stairs?
Climbing up the stair is safe for the older persons. You can climb step by step. You first put the good step and then put another step by the side, and you can climb slowly up the stair. But never try to get down from the stairs, because that is the one major risk factor for fall in the older person. So even if there is no option, to getting down as a lift or staircase, it is you should be very, very cautious. Don't use those bifocal glasses if you are using while getting down. Let the glasses, you will be off the glasses and slowly and politely try to get down. But that should not be your daily affairs. That should not be a daily affair. So you're likely to fall if you use the bifocal lens while getting down. And second, again, put the weak step down and then the good step down. So politely, and you can even use the cane. Sir, you can even use the cane while take the support. One hand with the rail and one with the cane. Slowly you get down. While getting down, you are likely to stoop. That is another risk factor for fall. So use the cane. That will help you maintain your balance and come slowly. Step by step, you come down slowly. There's no hurry to get down. But as much as possible, please avoid climbing stairs and getting down even in your own home as well.
you, doctor. And just another addition. आप एंड करें मैं बूढ़ा हो गया बोल के वो मैं सब दोस्तों को बोलता हूँ मैं बूढ़ा नहीं हो गया मेरी उम्र हो रही है.
You are right, sir.
Thank you.
Age
Thank
is
you.
just a number. Age is just a number.
Exactly.
And you
Yeah.
are so active, healthy. At this time of evening, you are still online. So age is just a number, sir. Is again your quality of life and your willingness to participate has kept you young by heart. So
Hello.
Yes,
As a-
Dr. Hemant.
hello.
Yes, Dr. Hemant. Yes.
How
As a
can we
person
join the
who has
Baroda
fallen-
Club, sir?
Hello.
Dr.
Dr.
Hemant,
Hemant
sir.
first,
Can we
and then
join
I'll
the
answer the
Baroda
other.
Club, sir?
Dr. Dolly, please wait. Dr. Hemant, sir, please.
As a person who is an adventure sports lover, who has fallen twice from mountains to ordinary staircase, my hints are following. Number one, get proper sunlight over your exposed fatty areas, all old people. Number one, that will give you adequate vitamin D and no overdose. Number two, even while you are sleeping, do straight leg raising test. 20 seconds, hold up your quadriceps and keep eyes up. Then
Agreed, sir. We just lost your connection. You are right, sir. Simple exposure to sun, we all know that it gives vitamin D. At least in morning, 10:30 or 11, we just walk around for 10-15 minutes in the sun and we get a lot of vitamin D.
Sir,
And
will you let
as
me complete?
yes, sir, you are off there.
Hemant, your voice
Please
was
continue,
off.
sir.
Not
Please
letting me
continue.
complete.
Hemant, your connection
See,
is unstable.
Go
after
ahead,
that,
sir.
there are anti-skid. You are anti-skid.
Anti-skid socks.
His connection is unstable. I can't
Dr.
hear.
Hemant, you are cutting out.
Anyway, is there any other question? We can take up few more
My
questions.
point is, hello, am I connected? My simple point is very important point is, am I audible?
Yes, sir.
My simple point is three very important, only brief points. Anti-skid 3M take.
No, we can't hear you.
Freestyle.
Yeah, his connection is unstable. So somebody was asking about Saturday Club. You can note down my number. I will add you in the group so that you can get all notifications for Saturday Club morning meetings. But essentially, the link remains same. Every Saturday, 8 a.m., we have this meeting. So you can note down my number or I'll write it down in the chat box. You can copy from that.
I will share to madam, sir. I'll share your number to
Please do that.
Yes,
Please.
sir.
Yeah.
Thank you, sir. Thank you so much, sir.
Yes,
Thanks.
she is a practitioner in Delhi, and Dr. Mangala is an past head of Department of Geriatric Medicine in Aurangabad, Government Medical College, Aurangabad. So,
Great.
Can I
yes,
give
sir.
the
Dr.
link?
Hemant, sir, please continue.
Yes, you can continue.
Anti-skid 3M tapes.
Okay.
Anti-skid 3M tapes are very important to prevent fall. Railings all over are very important. And there are Vibram shoes and floats, Bata, anti-skid sleepers. Plus what you said about anti-skid bathroom, this thing. So first, my request is there are lot of measures which I want to add, that after the fall, how I recovered after proper physiotherapy, and we can prevent lot of falls. Thank you.
Thank you, sir. Thank you so much.
Thank you, Hemant, for those comments. Any other comment or question? There was a question in the chat box regarding how does high dose vitamin D would increase the incidence of fall.
Yes, sir. There are a lot of studies that tell even we don't recommend vitamin D supplementations and even calcium supplementation to all persons unless they have. This was a large study which they mentioned that high doses of vitamin D supplementation, almost 60,000 units per month, has in fact led to, that was a study they have done in large number of population. They have found that they were the people who had more falls than those who were not given the fall. So they came to the conclusion that just supplementing vitamin D will not protect you from the fall. But how the mechanism, they have not mentioned that studies.
It's an observation.
Sir,
Yes.
excuse me.
Yes, sir.
I
Please
think
go
it
ahead.
is an observation only.
Yes, sir. Please go ahead.
Yes, sir. So it is a wonderful journey. We come across with several problems related to fall and all that. So age-old persons, they have problems like hearing and also the eye. In coming weeks, it is better if you address each and every problem usually the elders will face. So today is a wonderful talk wherein we have to take care of ourselves. A lot of the care and other safety measurements have been discussed. Thank you, Dr. Amali, sir, for giving a nice presentation. Thank you.
Thanks. Thank you, sir.
In fact, Dr. Venkatesh has echoed my feelings because the population of Saturday Club membership is more toward the old age. So we all look forward to a lot of things that we would like to know about. But I need to appreciate Dr. Anand here because 8 a.m. was not the right time for him because his OPD starts very early.
Dr.
And you are
Sachin,
kind
please
enough
mute.
to agree to this timing. So thank you so much,
Yes.
Dr.
Thank you, sir. It was a privilege, sir, to be with your this one Baroda branch, and I'm really overwhelmed with it.
Thank you.
Sir, thank you so much. It was a wonderful session.
Yes.
Thank you so much.
Yeah, thank you, Dr. Sachin.
Namaste.
Any other comment, question?
Satish bhai, even a single fall in a hospital management can lead to closure of the hospital according to NABH criteria.
Right.
Agreed, sir. I agree with you. In a fall, a delirium in the hospital, post-operative delirium, all are considered as negative marks for NABH accreditation. And that's why in the USA, fall in hospital is considered negative marks. That's why they tie the. That's why I showed the photograph. So I agree with you, sir. And that should
Another aspect is sleep. Sleep apnea and mouth breathing are the main causes why the elderly get a lot of thirst. He gets up and drinks water and then falls. So taping the mouth with a simple 3M tape, can lead to not dry mouth, and he cannot get an elderly gets up, drinks more water, and has a bathroom fall at night. So simple taping of the mouth by a simple mouth to avoid mouth breathing. There are a lot of things. The root cause should be analyzed medically as well as physiotherapy and occupational therapy and diet and nutrition. And vitamin D overdose happens because of chemical vitamin D. If you take a normal sunlight early in the morning on your fatty part of the abdomen, that gives adequate vitamin D.
Yes, sir.
Yeah, doctor, can I go ahead?
Yes, please.
Yes, sir, please.
I'm Mohammad Sirajuddin from Hyderabad, from Dabara, Madam Matin ma'am's group. I just wanted to have some guidance if the older people fall in the bedroom, and because they are very bulky weight and also, what are the measures that we can hold them up besides 2 or 3 persons helping? Anything other tool is there how they can get up? Because I found it difficulty in my mother's case. That's the thing.
Sir, yes, sir. It's obese persons or morbid obese patients. You get a lot of difficulty in shifting them from the bed and all. Now, hydraulic-based wheelchairs are available. So you have to just take the wheelchair near the bed, and the sheet goes into the bed. She has to just sit on the hydraulic set, and it pulls it back to the wheelchair. Though they are a little costly, but that will be a benefit, definitely benefit, that without even lifting her to the chair, she has to just sit on the hydraulic sheet that comes on the bed, and she can go and sit on the wheelchair, and you can move the wheelchair to the restroom or even to the dining room. So hydraulic based wheelchairs are available, and if she still can able to walk, ensure that there are railings across your home, so that will help them to walk around with the support.
No, I got your point, doctor. But the thing is, in the open room, everywhere you cannot put the railing. So in the center of the rooms, sometimes they walk and they sleep there. So from that place, how they should get up, or what are the tools? Because maybe the bed is near, but it's very difficult to hold and get up. So besides
The simplest
having
way
2-3
we have
people
done for
holding
my
them.
parents, doctor, the simplest way is a rope from the roof with a knot. When she is alone also, if the rope is hanging above her at 2-3 points, crucial points in her room, she can on her own take the rope and get up. And the rugs which doctor has said.
What sir is telling,
rugs.
Dr. Hemant sir was telling is to put ropes. That is practiced in most of the places. I think you must have also put already. So put the ropes so that they can hold and try to get up. But that is only to get up from the bed. Now your issue is from bed to down.
They are on the floor. They're already fallen on the floor.
So,
yeah, so
what
I had
Dr.
to call
Hemant
two
sir was...
people. I had called 2 people, to hold from both the sides. And because again, the person who is single-handedly handling, he may have some other type of injury or slip disc or anything else. So is there, I think there is no other way, right? Do you think?
Wheelchair, sir. You can support with wheelchair and move them on that. And even now wheelchairs are coming with multiple holes in the seat. Even if they can sit and bath them, no more water collection on the chair. It just goes down on the wheelchair itself. And wheelchair has a commode system. So sitting there also they can pee and shit. And the collection is getting down and it can be cleaned and again placed back. So
no, that is there already. That is there already. No, I have already. It has already been followed. I am just asking a person. He has already fallen, or she, like my mother had fallen. So how she has to get up?
Yes, sir.
The support, I mean.
It's about lifting up person who has already fallen and
fallen on the floor.
He is heavyweight. I think you need to have a stretcher-like thing where 3-4 people do it. Otherwise,
so again,
those
you
who are
require 2-3
helping may
people,
actually
right?
get spine
Yeah,
problem.
definitely you need people.
Exactly.
There is no way out.
There is a technique. There is a technique to lift that person. You put in a cloth like a dhoti under it, 1 or 2, and 2 persons from 2 sides can lift that up, dhoti up. And the minimum support and physics, that is the lever system, you can lift up, because I have done that with my father.
Okay, that's right. That's a good idea, doctor. That's a good idea.
And you see my photograph, you see everywhere, I have put these 3M tapes.
Yes, sir.
And railings.
Okay.
And
to identify the step.
These railings and 3M tape anti-skid are must everywhere where the skidding chances are there.
Right. That's a good suggestion.
Sir has already an ideal home to prevent fall. Yes. So he has already made so many changes. That's good, sir.
No person who falls will prevent. You will not believe, I went to America, I was on blood thinner. I made a special pediatric type of helmet of soft dissing so that I don't get brain hemorrhage after a simple fall and complicate the matters for the family. So prevention, what you are expect today, is the most important talk for geriatrics, and it depends on the care and the open mind of the physician and caregiver. And it starts with physiotherapy, diet, and occupational therapy, and orthotics and prosthetics.
Yes, sir.
For those last
you can
comment.
see my bathroom. I just want to show you my bathroom. I have modified in this manner just to hold it from here. And right now I've just removed the anti-skid, carpet which was there. And this is this railing.
Good.
And here it is.
Yes.
So the best thing I could do, and from here they can get up. So that's a very short distance. So by holding this, they can get up.
Right.
So I've not put the side ones.
That's good.
Okay. Thank you for sharing that facility that you created. But the fact is that now we have reached the time. Time is up now. It's already 9 o'clock.
Thank you. Thanks a lot, doctor.
Thank you, sir. Thanks for joining.
So last few comments here. Those who want to watch this video again or the past videos, it's available on YouTube channel of Satellite Club of Baroda. You can just type Satellite Club of Baroda and you will have about 126 such talks which are already archived there. So you are welcome to join all Satellite Club morning meetings. I will share my number with Dr. Anand knows my number, so he can share it with his group. And I can add people who are interested in our group so that they can get weekly notification for such talks. And another thing which I wanted to request Dr. Anand was that many such geriatric experts in our country. So we look forward to more such talks from other people also in this same field of geriatric medicines.
Sure, sir. I'll be in touch with you.
Yeah. Thank you for the wonderful talk.
Thank you so much, sir. Thank you very much for this opportunity.
And
Thank you, sir.
thanks to Dr. and Mrs. Nene also for introducing you to Saturday Club of Baroda. Thank you all. We end the session here and we meet next Saturday morning.
Thanks a lot, doctor.
Thank you, sir. Thank you very much. Have a good
Thank
day.
you. Thank you.